So we're going to start the Community Connect session in a minute. Please do take your seats.
Я буду делать summary всего, что вы скажете. Меня будет какая тема сегодня?
Yeah, have solutions. Perfect. Shall we start? Yes. Okay, great. Welcome to this Community Connect session, where 2 months on we reflect and learn from the community, academic and health professional engagement with the UN high-level meeting for actionable next steps. Let me first open with a video from my co-chair, Lucica Ditu, Executive Director of the Stop TB Partnership, who is unfortunately unable to be here in person today, but whose energy inspires, as always, along with her point about the power of coming together.
Hello, everybody. Greetings from Geneva. I have 2 minutes, 2.5 to share my message, and I have 4 points, so I'll go very quickly. First of all, I'm really sorry for not being there with you, because I think everyone in the room, from the amazing people that organized this panel to all the panel and everyone in the audience, everyone is amazing and super, and I'm really sorry I'm not there with you to give you a hug and to have a good energy pump there. The second point that I want to make is that we are close to 2 months since the UNHLM took place. And what we need to keep in mind is that not only the UNHLM, not only the UNHLM week, but the entire year of preparation, why was it so different than for the other diseases, and why it was so different even for us, is the fact that we actually really came together. That's for me a first and solid lesson learned, is that we really managed this time to bring together everybody, including civil society communities, academia and researcher, but also private sector providers, donors, technicals, and so on. We really created a community, and we were thinking all in the same way. And I really, really hope that we will continue in this way forward. This is my third point, related to the fact that while we look forward, we need to be mindful that we need to do 3-4 things. First is, as you already saw, and you will see also in the few days coming here in the Union, we really unpacked the targets, having a share for countries to see where everybody stays in terms of shouldering to achieve the targets and the commitments. And we also have what we call the popular version of the declaration that is using is a pre-digested form that is much simpler to be used. It's not enough for us to have it. We need to make sure that it goes at every single country level, that it goes not only to the people involved in the TB response, but especially to those not involved, as well as the prime ministers, the presidents of the countries, 2024 should be the year in which big part of our efforts should be around doing the advocacy and the communication around making the UNHLM targets and commitments knowledge, making people aware on them and understanding how we need to push together to achieve. So that will be an important piece that we come together and we push at country level, somehow at regional, somehow at global, but at country level, into the direction of making people understand these targets and achieving them. The fourth thing that I want to say, and the last one is, let's don't forget that what makes us absolutely amazing is being together, is dropping our own little agendas and coming under these broad things. When it's about tuberculosis, we all need to shoulder because we all want to end TB by 2030. So I really count on this because I know that we can end TB, and I know that, yes, we can end
And
TB.
TB.
Thank you very much, and I really, really miss you. Stay well.
Thanks, Luchika, for those words. So we came together as a community of academics, healthcare workers, survivors, community and civil society representatives, private sector representative and parliamentarians for the multi-stakeholder hearings on TB, universal health coverage, pandemic prevention preparedness and response at the United Nations headquarters in May 2023. When we worked together to influence negotiations on the political declarations of these three intersecting global health challenges ratified in September, the high-level meeting process provided an essential platform for stakeholders to voice their demands, drawing on their experience, expertise, knowledge, and skills. Today, we come together to critically reflect on our engagement through 5 short presentations to lead into a discussion with you, facilitated by my co-chair, Dr. Robin Waite, to exchange experiences, insights, and learnings, and collectively develop actionable next steps that we must now do. I'll introduce each speaker when they present. So I'm delighted to introduce our first speaker, Priyanka Iyer, who successfully led with Robin the 2023 TB HLM Coordination Hub. She will discuss how we came together as a community, engaged with the HLM process, the challenges faced, lessons learned, achievements made, and how we can use that collective power going forwards. Thank you.
Thank you so much, Kerry. So my background is in communications, and something that my training has taught me is to not presuppose anything ever. So with a show of hands, can I know how many people here know about the TBHLM? Great, fair enough. So I'm going to skip that part of my presentation. Now, how many people here already know about the work that the Affected Communities and Civil Society Coordination Hub did, or who we are, or what we did? All right, so for the people who raise their hands, you are going to be a little bored because I am going to still go over it. So the Affected Communities and Civil Society Coordination Hub came up with the sole objective of being able to create a space for affected communities and civil society people to come together to meaningfully engage with all processes of the UNHLM. We were a 2-people team. My co-lead, Robin, who was the policy and advocacy lead for the Coordination Hub, and I worked as the communication lead for the Coordination Hub. And our role, as I said, was to serve as a central hub to coordinate, inform, and share information as quickly as possible, and also provide hand-holding support to affected communities to be able to meaningfully engage with the HLM processes. And we were also guided by a leadership team, which consisted of advocates and activists from all over the world. Now, what are the approaches that we use to get the word out and engage with the communities? We know from our experience, and I'm sure everybody here knows it, that it's not a one-size-fits-all approach. So what we did was we took multiple approaches to be able to ensure that we are reaching the people that we want to work with. What did we do? We had regular deep dive calls every 2 weeks, because of which I have sent too many emails to too many of you, and I apologize for that. We used social media and listservs to send out regular updates. Again, too many emails, sorry. And then we specifically developed resources and toolkits to be able to guide not just country level action, but country, regional, and global level action. And basically, the idea behind these toolkits was to give the reins to the community members. These were dynamic toolkits that people could take and change as they required, as fit their context the best. And then, of course, we spent some active time in resource mobilization because the coordination hub started off, or the proposal for the coordination hub was submitted with an X number of funding demand, but we unfortunately were not able to get it. And what included in the funding demand was active support for affected communities to be able to travel to New York for the multi-stakeholder hearing and for the HLM. But when that did not happen and the coordination hub came together in the space and in the way that it did, we took upon ourselves to ensure that there are resources available for community members to still be able to participate, to still be able to travel. And then, apart from just getting people there, getting people to New York, another thing that we tried to do was create a space for communities. And both at the multi-stakeholder hearing and at the HLM, one of our, I'm not going to go into the list of the events that we had, but one of the events that was highly celebrated and we got a really positive feedback from the community about was a community picnic, which happened both on the sidelines of the multi-stakeholder hearing and on the sidelines of the HLM. And it was not a work thing. People came together, sat down in a park, broke bread together, and had some fun conversations. And I think that was very, very important, and also sort of the cornerstone of the ethos that we brought to the entire process. We wanted to create a space for communities to connect. Not just connect for the HLM, but connect as a whole. But this process has not been easy. We had challenges at every step of the way. One of the key challenges was that, both Robin and I, and we are being very candid here, were new to the process and also new to the process of engaging with an institution like the UN. So sometimes we did not completely understand how the processes are going to go and how step A is going to lead to step B or C. But whatever we could, we would just scrounge for information from whichever source we could and try to make best of it. Apart from that, there were consistent delays from the side of the President of the General Assembly's office in being able to communicate information. And what happened because of that, because we were working as the hub, we would oftentimes be in a situation where we did not have enough information to pass on to the community members. So how did we mitigate that? We didn't stop. We went on to find information through other resources, be it through Stop TB Partnership, or look up to our colleagues at WHO to give us the information, or just rely on the institutional memory of GFAN, which was the organization that was hosting us and had done the exact same process 3 years ago when the TBHLM for 2018 happened. So that's how we basically tried to manage all the challenges that we had. Apart from that, I've talked about the limited financial resources, but two other things that I want to talk about is because we were working with such a varied community and putting out so many resources in one go, what happened was that we were not able to get enough feedback or sort of understanding as to how effectively or even at all our resources are being used. Trying to get people to tell us that we are using these resources and these resources are actually useful was like pulling teeth. It was bad. So we had to rely on the data that we had from our website's backend, which was basically the number of downloads and the number of page views. So this is something that's a huge challenge that we were not completely able to mitigate, and we hope, the coordination hub has come to a close, but if there is a space to invigorate the coordination hub, we would hope to mitigate this challenge perhaps by some other means. Maybe technology can help us there. But that was one big challenge. And the other one was that generally on a global scale, there has been a squeezing of the spaces that has been available for the affected communities. And one big example, which is very tactile in that sense is that I would just like to bring to your notice that the room that was allocated in 2018 was much, much bigger than the room that was allocated in 2023 to the TBHLM. What does that mean? It essentially means that the spaces, the seats, the actual physical seats available for affected communities to be in the room get reduced by a huge margin. Now that's an issue, and that's something that the kind of intel that a coordination hub, if we were continuing to work, could bring to the foray and could work around. There were a lot of lessons learned throughout the process, of course. Working with diverse affected community members and civil society groups means that you will have that many diverse perspectives. And when the zero draft of the political declaration came out, it was a very, very weak and lukewarm draft. But because we were working with so many partners across the globe, we were able to bring in multiple perspectives. And though, in my personal opinion, the 2023 political declaration perhaps doesn't completely match up to the strength of the 2018 political declaration, we have come a long way in terms of the targets that we have, the language that we have, and the credibility and the strength that it gives to the affected community members, and also the language around a human rights-based response. It's crucial, of course. I hope that I have been able to communicate this, but it is crucial to be able to fund coordination mechanisms, much like the coordination hub, because this takes time, this takes effort, this takes human resources, and to be able to say that, oh, but this should be done pro bono or to be done at minimal funding is not fair, effective, or sustainable. So what we need is funding. What we need is dedicated, large funding to be able to sustain a mechanism like this, and there is value in being able to do that, because we are all people with diverse priorities, and if we cannot talk the same language, we perhaps will not be able to fight this fight as effectively as we probably can. And then there is, of course, the global level political push and pull, which caused a lot of issues in terms of what the countries wanted to say in the political declaration. And that was not always related to the actual fight, FTB, but more a political agenda, which was something also very, very difficult to navigate. And some people who are here and who were actively involved in the processes of the political declaration being finalized will remember that right at the end, it pretty much became just a political issue and no longer was an issue of being able to overcome a disease that's a global threat. What were our impacts and achievements? I want to start by these two wonderful photos. The one at the bottom is Dr. Tedros. I mean, it's a badly cropped photo, but apologize for that. Dr. Tedros waving the red document, which is the key asks from the affected communities and civil society at the HLM. So the level of buy-in was at a very high level, and we were able to do that. And when I say we, I do not mean Robin and I mean all the community members everywhere. Some faces I see here and some faces I don't, sorry. But that was one of our biggest achievements, that there was high-level buy-in for what the communities were asking. And the second photo, of course, is from our picnic, where we were able to create space for affected communities to come and connect. I'm going to leave this presentation, of course, available on the union website, so I'm going to skip over this. What is our recommendation? Of course, prioritize ongoing capacity building. Capacitated affected community members are the strongest strength that can change the tide when it comes to fighting TB. We need dedicated resource mobilization and dedicated funding for coordination mechanisms, much like the Affected Communities and Civil Society Coordination Hub. We need to not only nurture the existing advocacy networks, but also support new advocacy networks to come up. And of course, we need to ensure that we are collectively engaging in resource mobilization to be able to sustain, if not the hub, another mechanism like the hub. So that's the end of my presentation. Sorry for being
Thanks
over
so much,
time.
Priyanka. So on to our second speaker, Dr. Jess Potter, who will present from the perspective of academics and healthcare workers engaging with this year's UN high-level meeting process to call for change and explore how global coordination can help us mobilise around key moments, share best practice, and make most of the academic and healthcare worker voice. Jess.
Hi, good morning everyone. Thanks very much for having us all here today. My name's Jessica Potter. I'm a consultant in respiratory medicine and lead of one of the many TB services that we have across London in the UK. I also co-chair along with Kerry the network UK Academics and Professionals to End TB, UK APTB. So really I'm here today to say how important it is that everyone's voice, both the voices of TB-affected communities, TB survivors, as well as academics and healthcare professionals, is absolutely needed in order for us to end TB. We spend, as healthcare workers and academics, each and every day listening to people affected by TB. And by doing so, we gain a unique perspective and understanding of the issues that people face and the challenges that we need to overcome in order for us to end TB. We can provide insights to policymakers, to politicians who have the power to affect change. We can give them the tools to show them the way through the barriers that might exist. We can provide them with valid, robust knowledge through our research. And we have a powerful voice, and we need to use that in order to join together and sing as one choir, as we said in a meeting earlier this morning, to end TB. So, as a network, we came together ahead of the last UN high-level meeting for TB. And our aim in doing so was really to try to affect the political declaration, to bring academics and professionals across the UK who work both within the UK context but also work overseas and conduct global research and understand what they're doing, what knowledge they have, and try to ensure that that knowledge is reflected within the political declaration itself. And we did that by gathering emails and speaking to lots of people. We have an all-party parliamentary group for TB, and that was one of the first times that really we see politicians and policymakers in the same room as academics and healthcare workers. And it was a moment to get all the names together, because that's certainly one of the barriers that people might face in their own countries. And you know, hearing from the voices of the people in our network is really important. So I asked one of our colleagues who provide evidence to us and have been involved in this research process, and they said the reason they got involved was, I come very much from a research perspective with some experience using modelling to support country-level decision-making, but I don't have any experience with trying to influence the discussion. And I'm sure that that's something, you know, an experience shared by many people who work in academia and also healthcare workers as well. You know, we see the problems, we understand the problems, but how can we make policymakers see those problems and understand those problems and prioritise those problems so that they're funded? So one of the ways that we've gone about that is to engage with policymakers through several different mechanisms. We've held meetings online, virtually, where we've invited policymakers across a range of different government institutes and areas to meet with academics. And we've created spaces for those conversations to happen. And we've talked to academics about how the language they might use when having those conversations. So the point that they want to make is understandable and grounded in people's experiences. And we've also had meetings in person. So, and Kerry led one of those meetings up in Liverpool, and where we brought together politicians, often like a photo opportunity, and this was one of them. And that again allowed conversations to happen, not just in formal meetings themselves, but in between times, so that they can understand the challenges we're facing. And then we've done a bit more kind of external lobbying, so writing letters to government stating what we perceive to be the problem. One of the main issues that we're facing in the UK is access to fixed drug formulations. We don't have access to rifapentin. We have struggled to access pretomanid, and so the patients that we have in the UK are not accessing the treatments that they deserve. They're not accessing the most up-to-date treatment strategies. And that's something we're trying to work with policymakers, with government to change. We also engaged throughout the UNHLM process, attending the community network meetings. We went to the high-level meeting itself, but most of the work happened way in advance of that. And that was about hearing from our networks, trying to understand what knowledge they had that they could bring to the process, and sharing the document so that they had sight of it, and so they could edit it themselves. And I've got Richard White here to give his perspective on why he thought it was really important to get involved in the UK Academics and Professionals Against TB network.
I think I spent the first 10 years of my academic career having precisely no impact on public health policy and practice. I like to think that's no longer the case, and I feel my work regularly supports decision making. And a crucial part of that change is joining the community of academics and healthcare workers that spend at least some of their time directly supporting decision making. The academic and healthcare workers' voice, I think, is really important because it brings solid evidence into those policy discussions, which perhaps surprisingly may often be absent. Personally, I found that making evidence easy to understand and available is nearly always welcomed, and often has been directly used for the decisions on the table. That has been really rewarding, and it's a big change from 10 years ago. Engaging with politicians and policymakers in this UNHLM, I think we were able to help UK representatives think through the current priorities in TB research, prevention and care, and also help those same reps think through which of the proposed changings to the text that were made by other governments they would support and they wouldn't. And I guess, ultimately, I like to think we helped in some small way in the UK government's decision to be one of the only 3 countries, actually, that stepped up and made additional funds available for TB. Moving forward, beyond the political declaration, I think there are probably about 3 things we need to do. First, most importantly, we need to hold our governments to account for their pledges. For me, it's for the UK, and for you, your own governments. Second, I think we need to prepare, most urgently actually, for the UNHLM on antimicrobial resistance that's coming up in 2024. To be frank, AMR folks regularly try to exclude TB, which, given the very large burden of AMR that's due to TB, is patently daft. So I think we need to ensure that TB voices are heard during that meeting, and that TB is squarely on the AMR agenda going forward. And finally, I think we should all try and engage as much as we can with our politicians who are responsible for health and TB, so that we can support them. And so we also have a healthy working relationship with them for when the next opportunity to stop TB being ignored comes along.
Thanks very much, Richard. So just to end, really, I think, to summarise, we have an ability to reach new stakeholders and decision makers. We have expertise and experience that allows that engagement to be detailed, in-depth and evidence-based. And we have an opportunity to increase real-world impact of our research and advocate for increased funding overall. And just to echo what Priyanka was saying, funding for this type of organising is also really vital and needs to be thought about because we're all doing this, at least in our network, on the sides of our desks. And, other stakeholders are really very supportive, want to work with us, and we are really keen to replicate this type of work in other countries. So please, if you want to do the same thing, come and talk to us. We're here to listen and help.
Thanks so much, Jess. I'd now like to introduce our next speaker, Ola Klemenko. After experiencing discrimination through her TB diagnosis, she became a strong advocate in Ukraine and now describes the experience of her country in preparing for the UN high-level meeting on TB from the perspective of the community and civil society. Thank you.
Thank you to the opportunity to present our experience from Ukraine. TB People Ukraine is a national TB community. I think now it will be well. On the slide, you can see all the participants of the Ukrainian delegation and the stages of the formation process in this year in 2023. I want to say that all of the sessions that we have planned and prepared for Union, sessions about political questions, it's more hard for us because always when we're speaking about politicals or about our imagines, we need have only one result: actions and accountability. But in reality, when we try pushing this process, it can be some another results. And advocacy strategy for TB People Ukraine, it's only two aspects. Firstly, it's community leadership. We never wait in our political leaders. We every time push this process first. And second, our priority is the formation of the map of partners and definition of roles. It doesn't matter about what process we do. It's always two aspects in our strategy because it's important and help us to be constructive and sometimes achieve results. By the way, sometimes it's not bad results when we speak about community in political process. We always take the initiative ourselves, and the main things of us is to start a discussion at a high level. We began prepare for assembly in 2023 after assembly 2018. Because we have some national consultation, we pushed a process for development, some national strategy. We every time in our advocacy planning, including all some activities for adaptation and with declaration. And despite the war, our advocacy and political leadership, we had results. That new law of tuberculosis was development on a national level in Ukraine, and this law not updating from 1991. I think we can include in accountability, countries' accountability in process with declaration. In Ukraine, we have national partnership Stop TB Ukraine, and this platform was created in 2018 and united 75 NGOs organization. And in Ukraine, it's a clusters. When we speak about advocacy for community, we're speaking about TB People Ukraine. When we're speaking about advocacy from NGOs, organization, and civil societies, we're always speaking about national partnership. And in secretariat level, we started process preparing for communication with Minister of Health in March 2023. And after our some discussion, was next steps. and now we will speak about what I mean when we speak about maps for our partners and our roles. For us, it's really, I think in TB community role, we understanding where our places and what we can do. And every time we try to be strong in our area. But it was impossible without help from our partners. And we have clusters. Global level, it's a Stop TB partnership support, and this year it was hub, what Priyanka said. But Stop TB partnership support, it's always not only on HLM, thank you. For regional level, when we speak about ICA regional, it's TB Europe Coalition, because for civil society, it's really strong technical partners. And this collaboration, for national levels, we have strong, not always, but more time, we have strong collaboration with our NTP, with our ministers, and we have two big organizations. It's Alliance for Public Health and Network 100% Life. So TB People Ukraine National Partnership, Alliance and Network and NTB, together we are some group on the national level what pushed all advocacy processes. Such assistance helped the community to be participants in the process, including getting to know representatives of the mission and other stakeholders, because without this help, we can't do it. I finish. I have only 2 slides, so it's not be long. It was joint advocacy, and the results for us, it reached 2 representatives of civil society were included in the delegation, and funding was provided for both members. And now something about lessons learned and process what we have having today. Capacity development is not about webinars. I tell it now about civil society and communities. It is about English language courses, studying the mechanism of government parts and others actions make as TB survivor and experts. It's really important because how we can, so on this year, many of community members were not included on not only a national delegation, they were not included in this process in their country, because in political process, it doesn't matter that you are TB survivor. In TB political process, it's important how you're strong experts in this process and in strategy processes, and how you can be partners in this process. And we need to look for resources for this consultancy and not a month before the assembly, because this is not about us, but this is a reality for many communities, for more communities from many countries. The state does not finance the participants of civil society. We need thinking about this in our project, and not waiting when we can some projects for or some proposal from our partners before meetings, because it can be, but it can be. We are now conducting consultation and approved national plans, of course, maintain partners clusters, because for us, partnership, it's not only about meeting. For us, partnership, it's a collaboration in all our process, global level, regional level, national level, community. And only together we can have achievements and for our goals and have some better results than any another organization. Thank you.
Thanks so much. I'd now like to introduce Dr. Viral Sultan, Head of the Country and Community Support for Impact from the Stop TB Partnership. who will help us focus on how we implement key targets and commitments from the political declaration and the global plan at country level.
Thank you. I appreciate. Good morning, everyone. I don't have any conflict of interest. Put few pictures here that don't actually show the mood that we had in New York. I guess we cannot reflect this through pictures. It was very, very live, energetic, and I don't know, Priyanka, you said that you are new in TB with Robin, and not in TB, you are new in HLM, TB, and processes and UN. I disagree with that statement. Even we were there, and we are UN. We don't know how UN works. So we were like working all together. But what I'm trying to say that with your help, which was amazing, and with help of countries like Ukraine, as we heard in terms of experience at the country level, we had a big, big move. That week in New York, we had 3 high-level meetings. It was on TB, on preparedness and pandemic preparedness and response, and on UHC. I can tell you that the entire feedback was very clear that TB was backed by the civil society and TB-affected community fully. So that was like a statement, and I would say that indeed we had a very big move in New York that week that supported TB. Yes, I agree with the statements that maybe we don't have like the best political declaration, but I would say it's not bad. Like, it's not bad. Yeah, and probably we need to go, as a next step, we need to go and implement it. As it is not bad. So I mean, in the political declaration, we have a lot of targets and commitments there. From Stop TB Partnership, we pull them together, and I can tell you that those targets and commitments from the political declaration are very much line with the global TB plan to end TB. So it's basically the TB community all together is aligned around these commitments. We don't have anything that we would put a red flag or will signal and so on. I'm not going through all this. It's quite busy slide with all those numbers and so on. But I can tell you it's not, I mean, you know the old way of the sailors to see where the wind blows. It's like they do with the finger. So we didn't do like that in terms of establishing the targets and commitments. We had a group of modelers who took into account a lot of factors there in terms of where the incidence goes, where prevalence goes, how mortality will work, how, for example, introducing a vaccine in that year will influence the figures, the numbers, and so on. So we had a group of modelers working on that. Then we had a group of experts that were like, you know, touching with the ground, kind of like saying, no, you are too radical here, or you are too excited here, and so on. So we were like working in all together, and together with a group, a big number of experts, we put this all together and came with clear targets. So what is happening next, and what we did last time, and we are going to do together with you this time as well, we unpacked these indicators per each country. Basically, each country has its role in achieving the global targets and commitments. And we unpack every country based on every group of the targets and commitments there. And then we very much hope that together we go further and put pressure on our governments, on the decision makers to achieve those and to be accountable. I mean, to watch over them and see that they reach those results that we expect from them and so on. And of course, contributing also from our side. Um, on we discuss internally, and I guess tomorrow, I hope tomorrow we will present a first draft of those targets and commitments per countries. So that's the expectation. So we have the first draft. It's like last tuning day and so on, but everything is in place. And everything will come to this dashboard, which is on the Stop TB Partnership website, where you introduce the country and you will have all the targets per that country. Like clearly. So you will have a very good tool in your hands to go back and put that pressure and advocate for targets and commitment. And that's the expectation that we will work as a next step together. So I guess I will stop here. That's what I wanted to say, and happy to answer any
Thank you
questions.
so
that
much.
you have.
Thank you. On to our final speaker, Yulia Kalanchka, Executive Director of TB Europe Coalition. She reminds us of the importance placed in the 2023 political declaration on taking a multi-sectoral approach in the fight against TB, and how civil society is driving force behind accountability at country level.
Thank you so much, dear Chair and dear colleagues. I'm representing the leading civil society organization in the ECA region, Eastern Europe and Central Asia on MAF-TB implementation. And the topic of my presentation today concerns everyone sitting here. And it's truly inspiring to see such motivated participants of the Community Connect, even though it is not the most convenient place for the meaningful discussion. And despite this, I'm excited to share insights of the WHO Multi-Sectoral Accountability Framework on TB, which in short called MAF-TB, so I will use this term further when I'm speaking about Multi-Sectoral Accountability Framework on TB, and explore how we can put it into action in your respective countries, and fulfilling the commitments and achieving the goals of the political declaration on TB. Thus, let's embark on this journey together to make a meaningful impact in fight against TB. So, advocating for the goals and commitments of the political declaration on TB adopted in September this year is a key task for civil society and community over the next 5 years. Although the political declaration on the UN General Assembly on TB refers to a soft law document and therefore is purely advisory in nature, but still, nevertheless, it is most important international strategic document in the field of TB until the next 2028, so for the next 5 years. So this document gives us, as civil society community, a powerful base background, yes, to work with governments that have taken on the political responsibility to make every possible effort to implement the goal and commitments defined in the political declaration to end TB. So the WHO Multi-Sectoral Accountability Framework to accelerate the progress to end TB is a universal approach that can, in accordance with the commitments, ensure both the engagement of civil society and communities and all sectors, including the industries in the fight against TB, as well as it can also help to endorse the review of goals achieved at the national level and, if necessary, revision of planned activities and their optimization accordance to the review. So the political declaration on TB repeatedly mentioned the importance of multi-sectoral approach to fight the determinants of TB and ending the global epidemic. Using the QR code, you can go to the UN website with the full text of the political declaration on TB posted there in 7 languages, and on the slide you can see the points where multi-sectoral approach is mentioned. As you can see, of the 84 points of the political declaration, 7 mentioned the importance of implementation of MAF-TB, Multi-Sectoral Accountability Framework to end TB, and emphasize the commitments of countries and international institutions to launch this mechanism and implement this approach both at national and global levels. So why the multi-sectoral accountability approach is important to implement? So understanding the TB as a problem that extending beyond the health sector, multi-sectoral accountability framework to end TB aims to directly engage all relevant sectors and industries to systematically address the determinants of TB. Focusing on the person affected by TB and their needs at the center of our consolidated efforts, we must remember that in addition to the medical aspect, they face challenges in various areas like social, economic, financial, legal, and other. So barriers may arise in education, employment, transportation, and many other spheres because we know it from different researches and assessments. Moreover, when we talk about the needs to eliminate the social determinants of TB, this applies both to the determinants that leads to infection and to the development of the disease, as well to the interruption of treatment. Thus, only by addressing the determinants of TB through multi-sectoral efforts, we do have a chance to eliminate TB by 2030. This is why the multi-sectoral accountability framework is de facto the basis for achieving the goals and commitments of the political declaration set in the political declaration on TB. So to effectively adopt and implement MAF-TB, a series of strategic steps are recommended by the WHO new operational guide that was developed and presented on the eve of HLM in September 2023. This process began with creating a supportive environment at national and local levels, including, of course, the engagement of civil society and communities. A baseline assessment on MAF-TB sets the groundwork, followed by establishing and enhancing a national multi-sectoral coordinating mechanism. Crucial to this framework is building connections with sector beyond health, including the private sectors. The development of a specific MAF-TB implementation plan is but maybe the most key element, alongside intensified advocacy and resource mobilization effort, integrating universal health coverage and addressing health-related risk factors are essential components of the MAF-TB strategy. And ensuring equitable access to TB services focuses on the key drivers of the epidemics is another vital step. And the regular monitoring and reporting, along with the periodic review of the multi-sectoral TB response, are the fundamental measure to progress and make necessary adjustments in the action to eliminate TB. And through all these steps, the involvement of civil society community is really crucial. And because civil society and community representatives, they can and should play a vital role in endorsing and implementing MAF-TB as a force drivers, initially they focus on creating of a conducive environment on MAF-TB. For example, engaging in awareness raising campaigns among decision makers, advocacy activities, and liaising with key entities like Ministry of Health, NTP, WHO, and other partners. They also play a crucial role in involving donors and consultants to support this really important initiative. Once the government is ready to implement MAF-TB, civil society aids in conducting the baseline assessment using the WHO checklist and 3 annexes which complement this checklist, particularly focusing on civil society and community involvement in the TB response, which is Annex 2. This step often involves collaboration with international organizations and donors. And following the baseline assessment, civil society contributes to the development of recommendations for improving multisectoral coordination, which can be, for example, as a report after the baseline assessment itself. So this process includes creating a multisectoral plan, or as we said, the roadmap, for enhancing collaboration and accountability, developed in consultation with all major stakeholders in your country, where civil society and community, of course, should be engaged. And furthermore, civil society is integral in establishing or strengthening national multisectoral coordination and review mechanism, and in building connection with sectors beyond health, including private sector. And the last slide, I highly recommend reviewing the resources on launching the multisectoral accountability framework, specifically developed and adopted by the TB Europe Coalition for Civil Society and Community Representative to ease your work, because we already had bad and good experience in implementing this tool, so we can share it with you. And these materials provide the comprehensive insights into various aspects of involving civil society community into this important initiative and implementation of MAF-TB itself, complete with a practical example and actionable steps. And should you require further guidance on MAF-TB implementation on launching in your country, our team is available to provide you any consultation you need. So thank you very much for your attention.
Amazing. Thank you to all of our speakers, not only for sharing your experiences, but for doing a lot of the really hard work to engage meaningfully in the HLM process this year. So we have just over 10 minutes, about 12 minutes for questions from the audience to hear from you. There's not a ton of time. Let's be real, at conferences like this, we're mainly being talked at. So it's really important to go and create the space and time for you to continue these conversations at national, regional, and global levels outside of these 12 minutes that we have now. But does anyone have any questions for our speakers? In addition to questions, something you might want to share here is what you plan to do post-HLM to make sure that your governments are taking these commitments and translating them into action, and or what additional resources might be helpful to help you to do that. So we know there's going to be a really, really helpful tool coming out from Stop TB soon, but is there anything else that could support you in that work? So now over to you. Anyone with a question or something to share?
Yes, thank you so much. My name is Ali. I'm from United for Global Mental Health. I also co-chair a working group on universal health coverage for the Global Mental Health Action Network. We're a network of about 3,000 plus members from over 130 countries working on mental health. So basically, what we are looking to do now going forward is to just capitalize on the momentum of the various high-level meetings, mobilize our national partners to try and get those commitments to be turned into action at the national level. But then, given that that is something also that I know GFAN will be doing, Stop TB will be doing, and given the intersectionality between issues such as mental health and TB. So for example, if you integrate mental health into TB responses, you can reduce TB instances by up to 20%, and that means up to 14 million fewer TB cases by 2030. Is it wiser to be coordinating efforts at a global and national level rather than scrambling for limited resources? And what is the best way to sort of do that so that we go with a holistic person-centered approach rather than a siloed disease approach?
That's a great question. Does anyone from our panel have a reaction that they want to say to that? And maybe reflecting on the experience during the last 3 HLMs we just had and the very little integration that was happening.
Is this working? Yeah. I think coordination is absolutely vital, and moving out of our disease silos, because it hasn't worked so far, is also absolutely vital to come together with a broader, larger movement that is going to address all of the issues, UHC, NTB, pandemic preparedness, and antimicrobial resistance have a lot to share. I think that international coordination is vital, but each country is different in terms of its context, in terms of its politics, and therefore it's absolutely vital to do what Yulia was just talking about and implement at country level those changes.
Thank you. I mean, I will be provocative a little bit. Not that I am against of that. Full support and answering to your question, yes, we need to collaborate and we need to join forces and we need to do what we observe. When we start integrating TB with something else, immediately the attention goes out of TB. And TB is emergency, it's an infectious disease. You cannot compare. So when you start to arrange, you know, there is a saying, it's like when two brothers were like dividing something, and the older brother said, it's like, let's divide by like brothers. And the younger said, no, let's divide equally. You know, there is because the older one gets bigger portion. So when you put TB with something else, TB is getting less all the time. And this is what we observe. Just to be cautious in terms of like when we go and integrate something, let's integrate in a way that there is a mutual benefit of that. And we don't derail any attention from what we. So again, we are at Stop TB, we are not against of that. We support, but let's divide equally.
Any other panelists have something to contribute to that question? And any other questions in the room? Let's see the next hand. Okay.
Maybe sometimes something about national level when we're speaking about what's at a VRL to be, it's not priority in any country or some a few countries. And we support too, we collaborating with all organizations what working in Ukraine, but united in fundraising, in some work, we can only with diseases, with nosologists, what is this discrimination? Because it's really specific barriers. And when we, for example, in Ukraine today, with the leadership First Lady, development national mental programs. But we need develop some specific model for these national programs with needs people with TB, because it's a specific question. So if we united and try finding some financing for us, it will be easy for you, but it will be not easy for us.
And just to end, maybe, as you saw in my presentation, MAF-TB is not only about TB. MAF-TB can serve as a platform to engage other diseases and other, issues that you want to solve, like mental health, as you were saying. It should be integral part of the response for TB. So it's not easy to make it globally, because national partners, they decide on their own what should be in MAF-TB, yes, what kind of issue they would like to solve at the national level. So as I was presenting and I'm promoting MAF-TB implementation, I really think that MAF-TB can be answered to all these things and issues.
Great, thank you. So we'll go to our next question from the audience.
Thank you. So I'm Labia Kaji and I'm come from Tanzania. And it's good to learn about how the MAF-TB is really being implemented. So Tanzania is one among of the country which during the World TB Day of this year, so we launched it and we are grateful for that. So my concern is like maybe how can we like strengthen, the priorities and the work of the MAFTB, but also by ensuring time reporting, but also the issue of mobilizing resources. Provided now we launched it and we have it now, like, so we want to learn like how other countries are doing in terms of strengthening the MAFTB work and ensuring time resource mobilization and time reporting.
Great. I think that's a specific question for Yulia, and also maybe Virel can add.
Yeah, thank you so much. You're asking a tough question, let's say. I spoke about it yesterday because I was presenting as an expert yesterday, and the same kind of question came from the audience. So the main issue here is that if there is no political will, you should be a driving force first. So you should decide that you will be the one who will push this process at the regional or country level. So we as TB Coalition, without any funds, we decided that we will be those people, and we started negotiating with other governments, agencies. And first what we did, we had a huge collaboration with WHO Europe. Which help us a lot because they are also promoting MAFTB implementation, and they started like we negotiated with them and we asked them to start this process at the country level. So they started it, and they were this pushing force because civil society, they are not really have this impact on government officials and so on. But if national governments, they receive official letters from the WHO asking them to start implementation, to find the person, to identify the person who will be coordinating this response. So this is the starting point. If you have the coordinator from the national level, it's much easier than to start the work. And regarding the resource mobilization, it's very easy to find the resources if you put them into the application, and you will describe how you see the MAFTB implementation based on those steps that I was presented. And donors are happy to give the funds because this is the priority now for every sector to implement, like to have this multi-sectoral accountability framework. It's not, as I said, it's not only about TB. It can relate to HIV, to malaria, to hepatitis, or it can be a one platform for every disease. So you just need to write the concept note, how you see it based on the steps that WHO recommends, and just apply it to donors, and they will fund. Like, for example, we received for this work funds for this work from Stop TB. We receive it from CRG Global Fund. The representatives are here as well. So you can reach donors. They are happy to fund this this work.
Maybe quickly to add, how do you measure political will? It's like I would measure by number of, I don't know. No, actions. It's also like very volatile. I would measure by money. It's like if you reduce the gap in your country, it means that you have a political will, right? I mean, and that's the link. That's a simple link that I would answer to your question. How to link all this? It's a political will. We work for the political will, to increase political will in our countries. It means that those who are willing to end TB should put money in. That's it.
Great. Thank you. So I think we're going to wrap up this session now, wrapping up on time, which is remarkable. I just have a couple of closing remarks that I wanted to share before that. So based on the work that I was doing alongside Priyanka and all of you here with the 2023 TBHLM Affected Communities and Civil Society Coordination Hub, I've been reflecting on my positionality in the world and the work that I do, and also that of our political representatives who are engaging not just in the TBHLM, but in the PPPR and the UHCHLM. And I've written down here a couple of concerns that I saw that I want to share with you. And I'm sharing that with you because if we can see these concerns, maybe we can do something about it together. And then I'm going to leave you all on a note of hope, because there are hope there is hope and there are lots of solutions that we can leverage right now to accelerate progress to ending TB. So a couple of concerns to share that I saw. There was a serious lack of integration across the 3 HLMs and issues, and I feel like this was a massive missed opportunity that is going to kill people, and for that I am really upset. I found myself being upset with myself sometimes because I take my work very seriously. I was upset with myself because I didn't have the time and the energy to tap into the PPPR and the UHC communities because I was doing the hub work 2 days a week. And if I was trying to integrate into those spaces, none of the work that we did together for TB would have happened. But that upsets me that we didn't have the human resource to tap into those spaces. Because if we're an advocate for TB, we need to infiltrate every related sector to make sure that our message is heard in those spaces. And nobody seems to be doing that, or we're not doing that well enough in TB, that's for sure. The other thing was shrinking civic space, also very upsetting, and a lack of adequate support to facilitate access and meaningful participation. And this shined through in the HLM. Priyanka spoke to some of it, we all experienced it, but we're seeing it here in the Union Conference too. A number of our colleagues could not get here because they couldn't get visas. And I'm sorry, but the union and others didn't necessarily do enough to equip people applying for visas to be successful through that process. Or even like here, we're at the end of a hall. If you're not interested in the Community Connect sessions, you probably haven't sought it out yet. So we're gonna make people hear us in a bit. I question if the political declaration has been set up to fail. And I question that because let's look at the 2018 targets. Only one was hit. Like, really? If we're gonna make commitments, we need to make sure they're translated into action, and we can play a role in that, but every institution and every political representative of us needs to be playing their role too, and they're not right now. They need to do better. We can do better too. But also, if we look at funding, okay, so I've been looking at what's coming in through the Grant Cycle 7 for the Global Fund. If you look at TB, above, what it's called prioritized above allocation requests just for TB, just for Window 1 countries, which is only 19 countries, not even the highest burdened DRTB country in the world. And there's more than $770 million in above allocation requests. So I'm not sure we have the finances right now to deliver on the targets we just committed to. So way more resourcing is needed to get there. So all of this is upsetting, but there is hope, and here's the hope. I saw all of us come together and sound like a choir at the HLM. Timur talked about this earlier today at a session. He was like, we can't all just be like, no one's gonna hear you, but sound like a choir and people will hear you. And we were freaking rock stars at the HLM. Everyone heard us. So that gives me hope. Our advocacy also landed. We were effective. We started with a below zero draft of that political declaration, and by the time we got to the HLM, it had a number of our key asks in it. So as Varel said, it's not perfect, but we can work with it. And that's because of a lot of the hard work we did. Also, I see hope in the fact that we have new tools that if we leverage fast, can actually help accelerate progress towards eliminating TB by 2030. For example, the new BPAL-M regimen for DRTB. Countries want to use it. Again, looking at Window 1 applications or proposals for GC7, 15 out of 19 of those countries submitted proposals with plans to roll out BPAL. Let's get the resources to hand so we can make that happen. We just saw the WHO report come out the other week. I found hope in seeing the fact that there's a massive increase in finding people with TB, beyond pre-pandemic rebound levels. And that tells me that the TB response and the people working in it are innovative, and they're resilient, and they're able and ready to put resources to work. Look at what happened with investments from COVID-19 resource mechanism from the Global Fund. That money worked for TB. So I see so much hope. All we have to do is roll up our sleeves ourselves and make others roll up their sleeves and give a shit and do something about it. I self-identify as a global citizen who gives a shit. And I really hope that we can all collectively make this hope come to realization. So, we can end TB. So let's end on a chant. You know the chant. One sec, because I'm going to record it and put it on social media. All right, let's be so loud that everyone is like, who dat? And comes and finds out where the Community Connect space is, okay? All right, hold on a sec. Oh, no, this is not a selfie, Robin. Okay. Yes, we can!
NTB!
Yes, we can!
NTB!
Yes, we can!
NTB!
Yes, we can!
NTB!